Behind every routine doctor's visit, every single checkup, there's this kind of hidden language. It's a system of codes that, believe it or not, keeps our entire healthcare system running. It's how doctors get paid for keeping us well. And today, we're going to decode that language. Come on, you know what I'm talking about, right? You get that piece of paper in the mail, and it's just a jumble of numbers and weird abbreviations. It looks more like a secret message than a bill. So what do all those codes actually mean? Well, that's the mystery we're cracking today. So, at the very heart of this system are CPT codes. The absolute easiest way to think about them is as universal barcodes for healthcare. Every single thing a doctor does, every service, every procedure, every test, it gets its own unique CPT code. This is how a doctor communicates to an insurance company, hey, this is exactly what I did for this patient. Now, you gotta understand, these codes basically fall into two big buckets. On one side, you've got problem-focused care. That's when you go to the doctor because you're feeling sick. But what we're really diving into today is the other side, preventive care. This is all the stuff you get when you're not sick, and it's designed to keep you that way. The goal here isn't to fix a problem, but to stop one from ever even starting. To really see how this all works in the real world, let's follow a patient's journey through the healthcare system. And we're going to start right at the very beginning, in their earliest years. So the main code for a checkup, the very foundation of the visit, it actually changes with age. And there's a really clear logic to it. See the two columns? The system makes a distinction between a new patient and an established patient. And that makes sense, right? A first visit is going to take more time, more paperwork. And as a kid grows up, from a tiny infant all the way to a teenager, the codes evolve right along with them to reflect what they need at each stage. But these well-child visits are about so much more than just measuring height and weight. They pack in all these vital screenings to make sure a child is developing the way they should be. There are specific codes for things like developmental screenings, vision tests, and hearing checks. And these are all absolutely essential, because catching a potential issue early can make a world of difference for a child's future. And of course, you've got vaccinations, one of our most powerful preventative tools. Now, billing for them might look complicated, but it breaks down into a really simple, logical process. It's basically a three-step recipe. First, there's a code for giving the shot itself. Then, there's an add-on code for any other vaccines given that day. And finally, there's a totally separate code for the actual vaccine product, like the MMR or polio vaccine. See? Every single step is accounted for. So, how does this whole system build as our patient grows up? Well, as they move from their teens into adulthood, the whole focus of preventive care starts to shift. And what's really cool is that the same logic we saw with kids continues right on through adulthood. The system is just brilliantly consistent. The codes keep being broken down by age, and whether you're a new or established patient, it just evolves with you, recognizing that what a 30-year-old needs is very different from what a 65-year-old needs. Modern preventative care also gets that being healthy isn't just about what's physically happening inside your body. It's also about your lifestyle. That's why there are specific codes that let doctors bill for the time they spend talking to patients about things like quitting smoking, eating better, or managing stress. Those crucial conversations are now a recognized and billable part of what it means to keep people healthy. During an adult physical, it's also pretty common to get some routine blood work done. Think of it like popping the hood on your car to get a good look at the engine. A lipid panel checks your cholesterol, a metabolic panel looks at kidney function and blood sugar, a glucose test screens for diabetes risk, and yep, every single one of these common tests has its own unique code. All right, so as our patient keeps moving through life, preventative care gets even more focused, even more targeted. It starts using specific screenings to look for diseases long before any symptoms would ever show up. And this, right here, is where preventative medicine can be an absolute game changer. We're talking about screenings like mammograms for breast cancer, or colonoscopies for colorectal cancer, tests that are designed to find diseases at their earliest, most treatable stages. But it goes way beyond just cancer. The system also has codes for bone density scans to check for osteoporosis and even for mental health screenings. Each one is just a powerful tool for early detection. So why? Why do we have this whole elaborate system of codes just for screenings? Well, the goal, when you boil it all down, is pretty simple. It's to detect diseases in their early stages when treatment is most effective. That one sentence right there, that's the entire philosophy of preventative care. And it's why this whole system matters so much. Okay, so we've been following this one person's journey code by code. But now, let's zoom out. Let's look at the big picture. Why is this whole system so critically important? Let me paint you a picture that happens all the time. You go in for your annual physical, that's a preventative visit, but while you're there, you mention, hey doc, my shoulder's been really bugging me for weeks. All of a sudden, the doctor isn't just doing a checkup anymore. Now they're diagnosing a brand new problem. So how does the coding system handle that curveball? Well, the system has this really clever little tool for this exact situation. It's called Modifier 25. By tacking this modifier onto a problem-focused code, a doctor can signal to the insurance company that, hey, two separate things happened in this one visit, the planned preventative checkup and this unplanned diagnostic work. It's a key piece that lets the system be flexible enough for the real world. So, when you put it all together, you start to see that these codes are so much more than just tedious paperwork. They are the financial architecture, the very engine that makes our whole modern approach to healthcare possible. By creating a clear way to pay for checkups and screenings and counseling, this system is what lets the medical field shift its focus from just treating sickness to actively maintaining wellness. Ultimately, these codes are more than just numbers on a bill. They represent a choice. This system is how we've decided to pay for being and staying healthy. It's the language of wellness, and it leaves us with a pretty big question to think about. What does this code for staying healthy say about what we truly value in our health?